This Christmas, New Year, Sankranti, Ziva Fertility offers you a 30% discount on IVF packages. To know more about this, please feel free to contact us on the numbers that you see on the screen or visit your nearest Ziva Fertility Center. Thank you. Hi, I'm Dr. Suachla, Scientific Director with Ziva Fertility Centers. When you are trying to get pregnant, the most important thing, especially in a female's body, is ovulation or the release of the egg from the ovaries. This is a very important part of reproduction, and when the egg ovulates, it lasts for only 8 to 12 hours in the fallopian tubes. If sperms are present, fertilization happens, and about 4 to 5 days later, the embryo travels down into the uterus and implants inside the endometrium. The endometrium is the innermost layer of the uterus, which is where the embryo implants and the baby starts growing, the fetus grows. So this is basically what is happening during ovulation. Now it's very important to understand your ovulation period. How do you do that? Well, whether your period is for 25 days, 30 days, 38 days, no matter what, remember that your ovulation occurs about 14th to 15th day before your period. So if it is 38 days, you have to minus 14-15 days, it was behind. But the problem with this kind of calculation is that you cannot go back in time and plan your pregnancy. Therefore, the most important thing for you to do is to track your periods. For the next 3 months, sit down and write the date of your period. So when you do that for 3 months, you will get an idea whether it is 28 days, 32 days. If it is on clockwork, that is, if it is accurate, it's very well and good. If not, make an average of those 3 months and see to it that you understand your fertility period, that is your ovulation period. And once you know that, you can plan for pregnancy by having intercourse about 3 to 4 times in that week. This is an easy way of tracking your ovulation. But there are some symptoms also that your body is giving out. Like you may have stomach pain, especially on that side in which the egg is ovulating, if it is right or left. Sharp shooting pain or a dull pain. You may have back pain. Some people have cramps in their thighs. Their thighs pain a lot. It's like, they're being pulled. So these are some pains. Some people have headaches. Some people have soreness in breast and nipples. These are symptoms that your body is giving you. These are signals which the body is giving you during the time of ovulation. So make a note of this also when you are tracking your periods. Not just this, the atmosphere in the vagina also becomes very wet and slippery, and this is when it is very conducive for the sperms to survive in the uterus so that they can reach the egg faster. These are a few symptoms that your body, signals that your body is giving you to understand that the egg is ovulating. If you want to understand more, or if you have irregular cycles, you want to plan pregnancy and just want to understand your fertility window, please feel free to contact us. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.